when we heed a certain call, when the world must come together as one.
Lea Toto is a Swahili word which implies raising up a child. It is a community-based care program for the Children of God Relief Institute, formerly known as Nyumbani. As a program, we strive to provide care and support for HIV-positive children as they live within the extended community setting where they live within their family members. Provide basically the 6+1 services, that is healthcare, psychosocial support, food and nutrition, shelter, education, economic empowerment, and child protection. But on top of that, we also ensure, and this particularly the program office ensures this coordination of services so that we have improved quality care for the children. In the last 4 years, a number of structures, systems, and processes have been initiated to ensure full participation of the program staff in providing quality care for the children. All the program staff are involved in the planning. Every year, at the beginning of the year, we sit and plan together. Those plans are cascaded downwards from the program level to the regional level. We have 2 regions, Eastern and Western Nairobi region. We also have senders, and then from senders, individuals develop their specialized work plan for their own day-to-day implementation of the program.
Medical doctors get to go to each center at least once every week in each center, now that we have 8 centers. Then we get to see the clients that the clinical officers have issues with. And we are also in charge of all the other personnel, so we get to discuss any other issue to deal with these clients. We also have clinical officers who get to see every client that comes to the center who needs who has come either for a clinical visit, either they are sick, or has come to keep their appointment, maybe if they are coming for drugs, for drug refill. We also have nutritionists. Nutritionists get to review every client also. They get to give us the height and weight of all these clients. When they pick any client who is not doing well physically, they also get to see all those clients. We refer them to them.
Our nutritional service within the Lea Toto is one of the very key components that helps us to achieve the goal of the optimum health of our children. Now, we have developed this service in every center of the Lea Toto to see that it's a department on its own. And what it involves in it, every child who's coming to the Lea Toto has to be assessed nutritionally by professionals in that area, and the appropriate interventions come in. Now, we have activities of food distribution where we give to the families, and especially the families who have food insecurity in them. A lot of nutritional counseling happens. That is, the nutritionist would sit down with the families who have an issue with the nutritional adequacy with the families, and see how best they can teach them on what to prepare at home, which is locally found and will be of nutritional value to these children. We have come up with a Respite Center, which is a kind of a rescue center for the very malnourished children with challenging social issues that they cannot keep to the nutritional status that they're required of, or the minimum that is expected of them. So we take them out there, and for a short time their nutritional status is collected, and then they are able to be integrated back to the community while the family is able to take care of them nutritionally. Due to the stigma within the community and Africa at large, the presence of HIV, the diagnosis that one has HIV, brings with it a lot of burden, psychological burden. And for the families to be able to continue, live positively and take care of the HIV-infected and affected children, they have to be helped psychologically on a continuous basis. This involves pure counseling to the caregivers, pure counseling to the clients themselves, and counseling to other family members who are living with this child. This, we believe, helps them to keep going and to give the best care of this child. The staff counseling, where the staffs are allowed also to go through a session where they talk about the emotions and their feelings that they have encountered, which will help work with the challenges that they have gone through on a daily basis when they are doing their work in helping the HIV-positive child. We have also included into the mentorship, which now is very crucial because of the adolescents who might soon transit to the wider community. And the mentorship, we feel they have quite a lot of knowledge, they have quite a lot of skill, as far as HIV and AIDS management is concerned. And we want them to be positive and live with the community and be a resource to the community when it comes to teaching and telling them and living positively about the HIV. The social worker department has completely engaged with the families and the communities at large to see that they identify any factors that will suppress the progress and development of the child, even if there is a HIV with them, that the child has a safe and a living condition as per the minimum standard of care, including that they have an adult caregiver who is with them and looks after them and takes care of them, and then having a child-headed family. And also, the social work department looks into what is directly affecting, what are the direct needs affecting the lives of this family, and advise the program so that we can give direct support that would help the child to grow and develop well. In the Lea Toto program, we ensure that all children of school-going age, they access education facilities and they are supported adequately to see that they achieve that. This we do by encouraging the families to identify the schools that they will have to attend to, and even trying to provide what are the necessary materials, educational materials that they need so that they can make their education process a success. This is one of the services that actually do not go directly to the index child that we take care of. This service, we give it to the caregiver, and we feel by empowering the caregiver financially, they are in a position to give the best care or better care for the children they are looking after. We identify within the families that we are taking care of within the Lea Toto, identify who are the vulnerable families that we would need really to be empowered financially. And once we have identified them, we go ahead and help them to know or to identify within themselves what would be the appropriate income generating activity that would suit them better. And once that stage is achieved, we now help them into the process of establishing those businesses. And that is very key to them. And we follow it up to see that the businesses are established and they are running over well. In collaboration and networking within Lea Toto, this is one area that we realized we need for us to be strong. We need to grow in it, and we have challenged it and see that we enhance a lot of collaboration and networking. We know, and this is in us now, for us to achieve our goal better, we cannot do it on our own only. We need other stakeholders on what they're doing, as long as they're building and developing the community. And also the corporate world. And I'll give examples of that, like when we have medical camps and we do the medical camps jointly, that benefiting the community, but all the stakeholders come together and we do it with a common goal.
As part of our vision and mission as Equity Bank, we value people and we value children. And as we come together at this particular juncture, what we have decided is to come and celebrate together with the children. Because looking at them and the kind of life maybe they are leading, they need a lot of support, and this support cannot come from any other people than us who are actually working in the corporate world.
So the monitoring and evaluation team collects all this information, puts it together, and reports this information to the necessary people who require the information. We also make sure that it's available to even people who are necessarily not funders, but people who need to learn more about this organization. So we have systems in place, we have people in place to ensure that all this is facilitated. We have a system that is called the Lea Toto Information Management System. This is a system that stores almost 6,500 records of children that we cater for. So we've used these systems to report to the directors, to report to our funders, and we also use this system to give us data for local consumption.
Mama Sheila Chepkite has been a good caregiver ever since I joined Lea Toto. She has not had an easy journey. I met her when she was a little bit okay. She had started regaining her energy and her strength back, and she had accepted her status fully and started taking her medication. She had gotten into drinking alcohol when she had lost hope in life. She didn't know what to do. She didn't know where to go. She had neglected the child because she wanted all of them to just die. And because of that, she refused to take medication. During that time, Sister Julia journeyed with her very well, and she regained her energy. She talked to her most of the times. With their presence, with the help of the CHWs and the rest of the team within Kibera, they have worked hand in hand in the journey of the caregiver.
And thank God so much, because if it wasn't for Lea Toto, I don't think it could be in here. But because of Lea Toto, it has made me who I am today. It has made us to have a smile on our face. Sister Mary has done a lot unto us. He has built good stuff which has enabled us to build. The guidance and counseling has really helped us. It has manifested in me and to other Lea Toto kids. Lea Toto has been so supportive in terms of education. It has, for the school fees, it has been there. I really appreciate Lea Toto so much, and it's my pleasure to send my regards unto the staff of Lea Toto.
All humans will heed the 2011 UN Declaration regarding children who are infected with HIV. And that is equal opportunity for them and a non-discriminatory environment, socially and also in the learning area. Everybody needs acceptance from their other citizens, from all of us. So, HIV is simply a medical condition, like any other medical condition, like diabetes, for example. What would Christ do if Christ were alive here? And other religions can ask also that same question in the context of their religion. And my answer to that is Christ would have particular care for those who are challenged in any way. And in particular, I'm talking about children challenged as a result of inheriting HIV. I would like to express my deep appreciative gratitude to our program manager, Mr. Nicholas McCall, and his staff. Mine is oversight, but the program couldn't happen if we didn't have staff. And I love the phrase that Mr. McCall uses, and that is going the extra mile for our children. And I believe that our staff do that. We have quite a percentage of staff who have been in the program over many years. We love when we have staff reaching 5 years and we can award them. And we're beginning to award staff who have been with us for 10 years. Our program requires staff who have a feel for the child, who are there not just to earn a salary so that they can have a living, but they can give that little extra to the children, and I believe that they do that.
One of the ways that I speak to you today is simply in gratitude, as a person who is simply grateful for what on the ground and in the hearts and minds you are doing to transform the health of Kenya. And that specifically means that you are paying attention to how people get healthy. And my experience has taught me over many years of looking at both aspects of faith and aspects of health and aspects of education, that these three things form a way to be holistic in our care, and that we provide a healing ministry for holistic care to the people who have been affected by HIV. One of the things we're learning too in the United States, this comes with tremendous opportunity involving partnerships. So who are the key partners in health within the community, within the United States, within Italy, within Ireland? Who are the champions of health that we might begin to grow Nyumbani so that it is a place that people look at which is transforming healthcare?
Finally, we want to give a special thanks to our donors, the USAID community and the USG, particularly for the support over the years. We want to thank other donors who have stood with the Lea Toto over the years. We thank our partners particularly the government of Kenya, the line ministries that we work with, the government leadership at the grassroots level. We thank other partners that we work with in the communities. We thank our board of directors, both Kenya, US, Italy, UK, Spain, and Ireland. We also want to thank the COGRI management, starting with our executive director, Sister Mary Owens, and other management members. We thank the community that has given us an opportunity to serve them and reach their children. And in a very special way, I want to move a vote of thanks to my colleagues, the members of staff in Lea Toto, who actually translate our plans into actions and who have been able to transform the lives of the children. We salute you and may God bless you all. Thank you.